cause for me to be involved in the case is to assess the neuroimaging in Cauda Equina cases. This is a condition where there is abnormal function of the nerve roots which drape from the tail of the spinal cord, and this is often due to external compression or a lack of room within the enclosed space that we call the vertebral canal. And that can be for a number of reasons, but commonly it's because of disc herniations. I can think of the most complex case that I was involved with advising on with in a Cauda Equina referral was a post-operative case. And because of the difficulty in interpreting the imaging, there was quite some back and forth between experts involved in terms of trying to agree what the imaging was showing. And in fact, the experts on the other side, I felt, had misinterpreted the imaging on the initial phase. And I think post-operative imaging is very difficult at the best of times, and it's something that really does require close correlation with the surgeon's account, so that when interpreting the images, one is aware of what's gone on in surgery prior to the scan. Otherwise, interpretation can be very challenging, if not impossible. So this particular complex case involved surgery, and it involved a tiny fluid collection that was away from the site of surgery that had been overlooked at the initial stages of reporting at the local hospital. And it was felt to be quite important because there had been a change in the dimensions of the space in which the nerve roots of the Cauda Equina are enclosed. So it was a challenging case. There came into question a lot of technical knowledge that was required to interpret what the scans were showing, because a lot of packing material had been introduced by the surgeon because the wound was very oozy at surgery, and therefore the surgeon had chosen to use packing material to absorb and compress the surgical site. And of course that made for a very difficult MR scan to interpret. And some complicated technical issues had to be brought to bear to really tease out what was going on there and what could confidently be established from the scan. And that was the challenge. And I felt that by the end of the process of negotiations between one side and the other, I felt that the case that we'd made had held its weight and had held sway. And in fact, it did precipitate a change in opinion from other experts. So I felt that we'd done a very good job on that case. But it was, I think, perhaps the most complex case I've seen in the medical legal arena, for sure.